Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well today. Want to educate you a bit about memory, dementia, Alzheimer's, and memory loss prevention or cognitive loss prevention. As I sit here in front of my articles I've written over the years here, and they're basically abstracts on research and stuff that I publish a couple times a year. I this weekend was reading a couple journals that had studies on and made me think of stuff that we know, but there's more and more evidence of this, and that is how viruses and certain things can be looked at very early on in dementia and cognitive loss that can really affect the brain. So New England Journal of Medicine just published a study that showed that there is a link, and we should be looking at viruses like herpes virus and shingles virus that can affect the brain and can cause a higher rate of Alzheimer's. And this is a big concern, and because we know the rates of type 3 diabetes, you're right, I heard that, you heard that right, type 3 diabetes, which is the new Alzheimer's, and the reason is because sugar rots your brain. You have to think about what sugar is doing to your brain. But viruses, particularly herpes viruses and shingle virus, can actually cause an inflammatory response, and there was higher rates of tau proteins and plaques in the brain that affected patients in a significant way on their memory, and then compounded if they had a genetic trait like ApoE4, then their rates were even close to 30% risk of developing Alzheimer's in their life. So if you're someone out there that has herpes or has had herpes, and it's something that has to be watched and managed based on like stress responses and immune responses, and you've had shingles, or you are worried about getting shingles, or you have had shingles, you, even if you're not flaring at times, you want to look at those antibody levels. You want to consider natural or alternative or traditional approaches to antivirals like Valtrex and acyclovir antivirals, or natural antivirals like we have, like silver, and ozone therapies that get rid of and help balance your immune system and get rid of these viruses, because we do get exposure to many viruses that we're learning more and more about that affect the brain and can cause cognitive loss. So you got to consider these. But what is the first thing that you have to look at and be aware of to prevent dementia? Recognition. So you need to see a functional medicine practitioner like myself or my practitioners here at Longevity Health Institute. We will look at you in a very personalized, specific way, okay? And that is not just that, hey, you're fine now, your mini mental state exam is normal. We do dementia screenings, and we look at specific laboratory numbers like your ApoE4, but also one protein peptide called BNP, brain natriuretic peptide. So there is evidence, and I will tell you here clinically, when people have a elevated brain natriuretic peptide, that they have a weakened blood-brain barrier. So that's the protective barrier between essentially our brain and our body. And so then you are more prone to these viruses or inflammatory or unhealthy responses, if you will, that then affect the brain. Whether it's just general aging, dementia, or cognitive loss, or you're crossing now a virus across the brain because a weakened blood-brain barrier picked up on a blood test BNP, whether you have genetic risk or not, and now you're at a higher rate, a risk of Alzheimer's. So first of all, you got to come in. You got to see a practitioner. You got to see a functional medicine doctor, somebody that looks at you in a very personalized way, because they're not just going to talk and how's your memory and what does your partner and spouse and family think. They're going to test you, They're going to test ApoE4. They're going to test hormones. They're going to test BNP. And they're going to do a dementia screening questionnaire, And even if you do well in that, we track this every year or two so that we can see any changes or progression, okay? But early intervention in memory loss and dementia is key. Identification and early therapies are key. Now you heard me say this correctly earlier in the video. Sugar rots the brain. We call dementia type 3 diabetes. Why? There's evidence that elevated insulin, elevated blood sugars cause earlier cognitive decline. When you cause cognitive issues because the brain is atrophying because of blood sugar and because of hormonal loss like estrogen and testosterone in men and women, the brain atrophies. We'll get CAT scans and MRIs and functional MRIs, okay, SPECT scans, and we'll see patients' brains literally look smaller in their skull. When you talk about the volume and weighted volume of a brain that was different in a 40-year-old versus a 60, 70-year-old, okay? But again, early recognition for cognitive issues and Alzheimer's and dementia is key. So you got to consider these things, but first you got to come in, you got to be seen, you got to be evaluated, okay? My practitioners, myself, are experts in looking at you always in a personalized way, so make sure that you see somebody that looks at you in a very detailed, personalized way, okay? We can't just wait for the disease and have the treatment or the cure. We got to be preventative in any and everything, whether it's hormones, gut health, diet, immunity, nutrients, detoxification, etc. You have to be in a preventative model. So let's keep our brains healthy. Let's keep them solid. Let's be forth thinking, okay? Even if you're 40, 50 years old, okay? Make sure you're ahead of the game and you got some of these tests. Even if some of these tests are normal, you now have a baseline that you can track and follow, okay, as you age and see the changes. So then at 55, 60, you know if there's some intervention that needs to happen or we need to up our game in prevention. So again, let's take a look at your BNP, your ApoE4, your inflammatory numbers, potentially your viruses like herpes and shingles, okay? And hormones are always preventative in brain health. Gut is super key in making neurotransmitters for your brain and protecting the brain and giving it the sharpness it needs in electrical activity, okay? But we got to look at all these things to prevent cognitive decline, prevent dementia, and prevent Alzheimer's. This is Dr. Lewerenz, Longevity Health Institute. Keep being good, we'll make you well. Let's thrive, not just survive, right? We're here in Rochester Hills, Michigan, Madison Heights, Michigan, soon to be on the west side in Bloomfield, Michigan. Me and my practitioners are always happy to bring you the best and functional, personalized medicine. Be well.